My name is John Wilding. I'm Professor of Medicine at the University of Liverpool, and I'm here talking from the International Congress of Nephrology in Melbourne, where we've just heard the results of the CREDENCE trial with canagliflozin for type 2 diabetes in patients with chronic kidney disease. What the CREDENCE trial shows is really very clear benefits for canagliflozin treatment in patients with diabetes who also have chronic kidney disease. Now, these are people who are at very high risk of requiring dialysis or transplantation as a result of end-stage renal failure, and also this group of people are at very high risk for cardiovascular disease. And the trial not only shows very clear benefits, 30% reduction in progression to end-stage renal disease, but also confirms the findings that we've seen in other trials with canagliflozin and other SGLT2 inhibitors in terms of reductions of cardiovascular disease, heart failure hospitalization, stroke and mortality in this group of high-risk patients. Importantly, we've also seen that the results of CREDENCE show that this can be done without any new adverse event findings, and indeed some of the other concerns that we've seen with this class of drugs and with canagliflozin in particular, such as concerns about increased risks of amputations and fractures, were not actually seen in excess in the CREDENCE trial. So I think this is actually very reassuring for those of us who treat people with diabetes who are at high risk of cardiovascular disease and who have renal impairment. The situation up till now with this group of patients has been that for the last 15 or 20 years, the only options we've had have been to use ACE inhibitors or angiotensin receptor blockers to reduce the risk of patients with diabetes and chronic kidney disease developing renal failure. And it's important to note that the CREDENCE study was done on the back of these treatments. So 99% of patients in the CREDENCE study were actually taking an ACE inhibitor or an angiotensin receptor blocker. Of course, there are some limitations to this trial. The group studied was very tightly defined. It only included patients who had significant albuminuria with a urine albumin-creatinine ratio between 300 and 5,000. It didn't include patients with chronic kidney disease who did not have albuminuria or had microalbuminuria. And of course, it would be very interesting to see in the future whether these very encouraging findings extend to this broader population of people with chronic kidney disease without albuminuria. But I think that's going to be a question for other trials. So overall, I'm really pleased to see these very encouraging results from the CREDENCE trial. And I think this group of patients who really haven't had any new treatments available to improve their risk of developing renal failure and requiring dialysis is going to make a big difference to the treatment of people with diabetes in the future.